Jesse. So
Yeah, it's some hard R's.
Yeah, I can't roll my R's either. I know people roll their R's when they say your name or no.
Yeah. Oh yeah. When we go to South America, maybe get some of those. It sounds better when they say it. Yeah.
Nice. Well, thank you for coming down. Appreciate
Yeah, of course.
You.
Thanks for having me.
Love to have the audience get to know about you and your practice before we dive in and kind of chat about, exercise techniques, longevity, and some of the things that are very near and dear to your heart.
Yeah, sure. So my name is Jesse Greer, and I run a practice called Preamble. We're up here in North Scottsdale. Just a little bit about me. I was a military physician, so I went through medical school. I went to the military medical school, Uniformed Services University. I owed 7 years to the military.
Thanks for your service.
Yeah, of course. So did my internship or my residency in internal medicine, and then I spent 7 years kind of working out in the Army, mainly underneath the Special Operations Command. And yeah, just had a lifetime of experience. Had some pretty cool jobs, and I don't know, learned a lot about the way the world works. So
I'm sure you've seen some stuff.
Yeah, so we got to, serving at a time like that, you get to see kind of all humanity has to offer, for sure.
Yeah. Awesome. Well, thank you. I appreciate you being present, kind of chat. I know we've talked briefly in the past, and I've seen your lovely clinic and what all you do, so that's great. You putting me through that and realize how unprepared I am.
Well, we take a deep look. I mean, at like the stuff that I think you kind of inherently think that it matters, right? Mm-hmm. A lot of those metrics we got, those really shows how the body is working and compares it to how it should work for a healthy person.
Right.
Yeah.
Right. So, and we can kind of chat and go back and forth and, just share different ideas on different topics and stuff too. Yeah. But give me a sense of where do you feel like someone who's looking to, be more overall fit and also live longer, where should they start? What would be their kind of like the main thing to look at?
Yeah. It's a good question. I don't know. Is it a cop-out answer of saying, I think it definitely depends on the individual too, right? And I know we'll talk about some exercise here in a little bit and more specifics, but I've just always found that people are going to have a hard time with fitness and a lot of other things in life if there are some problems going on upstairs, as far as the why people have, their purpose, whether there is, some high level of kind of anxiety and just, lack of emotional health.
Kind of mind, body, spirit kind of aspect.
Exactly right. And starting off in a journey of chasing your health, is just another violent shot in the wrong direction, and so I guess it kind of depends from that standpoint too. And I think people have different strengths and inherent weaknesses that would probably direct maybe where they start moving in the first place, right? So there's people who just have these great lifestyles. They're super active because it's more of something that they enjoy. But probably not paying attention to, necessarily the quality of their fuel sometimes, or their long-term risk and things like that. Probably where they're going to benefit most from being able to look down that path. But I'd say probably the most common is the person who really needs to start focusing on the lifestyle and the lifestyle changes, right? And basically a reconception of how they like to think about being active. The amount of activity that they get, and how they think about their food. And it's just, those are just the giant boulders that you have to put into place before you can start kind of getting into this other crap.
So do you feel like their mindset on what they think of exercise, or what they think of what they're eating, or what food means to them, makes a huge difference on how you go about guiding them in the next steps?
Well, I think it's something that we try to emphasize and really drive with like our plans, our discussion, kind of the goals that we set with people. Like I'm just kind of showing them what rhymes with, right? They kind of have to understand that for themselves eventually.
Yeah.
But, we tend to think of exercise as something that is, super or quite high intensity, that it's own activity that needs time allotted in the day for it, because that's when you go to the gym, right? It's a lot more than that. It's the amount of activity that you're getting throughout your entire day, just how you go about planning your life, making sure that there's that level of activity in there. Yeah.
So you feel like someone who is exercising, going about their week, they're getting some points in, I guess, obviously based on some recommendations, you want to get, the kind of the 150 minutes per week comes to mind. It's kind of like a lot of the guidelines that are at least kind of the basics. But some people don't measure, some people don't use biometrics. Both of us are wearing Whoop. So,
Yeah.
So what are your thoughts on, is somebody who is actually, taking steps in regards to exercising, but they're just making it, just a fun activity for themselves, whether they're playing pickleball or playing volleyball. Is that something that is a good step taken forward, or you feel like, since you mentioned exercise really needs its own space, and also not just any exercise, you have to kind of like be very mindful about what you're doing and how intense. Are we wasting time if the activity is not properly measured with different metrics?
Yeah.
If you actually have a goal of reaching some sort of a health and fitness level. I guess how much should one dive into the numbers and the parameters and metrics versus enjoying the journey?
Yeah, that's a good question. I think we all kind of should start off with measuring some numbers. I think it speaks to certain types of people. I think it speaks to a lot of type of people. Some people get too wrapped up into it, but it does. I mean, I think it helps keep us on track with understanding how it is that we do move throughout the day. How many, what does our step count look like? What is the basic amount of activity that I get? When I do an hour of zone 2, how far am I moving? You start thinking about what 4 hours over a week looks like. How you plan that into your life. How you can get more. It helps give you this basic guideline of, hey, I kind of want to keep my heart rate under 130, right? And so kind of helps maintain the act of it, and it's huge in habit building, right? I mean, this is the level of activity that you're trying to almost create like an addiction to. Like, you don't let a dog outside all day, it goes crazy, right? Kind of like when you have that level of like, I just need to move my body, right? It grows from the use of things like these wearables and just the concepts and starting to understand them, and then it kind of blossoms into something like that.
Do you feel like that helps you actually kind of like the habits that you build to kind of see maybe numbers, encourage you to do more, and but then keep it within parameters, not to go all crazy and go overly addicted to that process.
Yeah, exactly. You just understand what type of exercise you're doing for yourself, and if you want to do those high intensity ones, it's great to show you that as well. So it's a great tool.
Yeah.
It's a great tool, but by no means is it like, should it be kind of used in a way to drive a compulsive behavior.
Yeah. You can kind of leave one bad thing for another. And I always say, if you have habits that are maybe not healthy, as long as you replace them with neutral or positive habits, that's still a win. Whether you're smoking or eating ice cream all day, and now you're replacing it with chewing gum or going for a walk. Okay, that's always still a win. You mentioned like the different stages of exercise. Or is there something that you break down for people who you're trying to kind of give them a general baseline as far as longevity, since your focus is mainly to kind of optimize fitness and health, and then also really focus on longevity? And so how much time frame of some of the different stages you mentioned do you feel like in general term for a typical, 30 to 50-year-old, would you say? I know that's a very broad
No,
age
I
range.
don't think it is at all. I mean, it is a broad age range. But what's interesting is the older we get, the more cumulative amount of time that we need kind of in that like training zone. We'll call it training, but it should look more
zone
like
2,
living
you're
life.
saying?
Yeah,
Okay.
and definitely, no, I mean, not just zone 2, like zone 1 for sure.
Okay.
I mean, like, yeah, zone 2.
And for people who don't know these different
Yeah.
zones, what's it good parameters you can maybe give?
Yeah,
So
so yeah. So I'm just referring to like these zone 1s and zone 2s as within this concept of a 5-zone system. And there's different systems with different amounts of zones and how that works. But when I say something like zone 2 or zone 1, I'm talking about that mild up to like moderate intensity type activity. Your heart rate's probably going to be below 120 to 140 for most people on average. You can still breathe in and out of your nose. Like you're briskly walking up a hill. You're briskly walking up a hill, like that level of activity, right? And then zones 3, 4, and 5, I'm kind of using as like that high end stuff. But when I'm talking about this, like this base level of training and throwing, like considering walking, considering this zone 1, 2 in this bigger pocket of just of activity, then you need more of that as you get older too. But I think we generally start off on like put this into your put like some zone 2 or just some walking 3 hours dedicated a week, really to kind of start that habit. I think you don't really start seeing too many benefits until you get to like 4, or you start seeing a lot more progress when you get to like these hours 4 and 5 within a week.
So of zone 2 activity.
Yeah, of
4
like
hours
if
plus.
it's pretty intentional zone 2, yes.
Okay.
But then when you start rolling in like the zone 1 and then the amount of walking that you should be doing, it's probably looking closer to like 10, 11 hours a week. And
even instead of zone 2, if you're just doing zone 1.
you just count them all together.
I
Zone
see.
1 and zone
Gotcha.
2.
They at least get 10 hours.
Yeah.
Gotcha. Okay.
So
What about high intensity workouts? The 3+ zones. How much of that do you feel like is necessary to kind of cover your bases in regards to your goal of longevity or muscle maintenance, for example?
yeah, I mean, I think that the answer varies a little bit, but like on the whole, it's usually like once a week, I would say.
Okay.
Unless we're training for something specific or for performance, then it kind of goes out the window. You know what I'm saying? But like in a sense of longevity, I know some people who just almost say even like that intense, like never do it for longevity, or just rarely do it when you have to. But basically you can train for marathons and you can train for all these events, with this low intensity stuff, right? Like it's not this extra accumulation of a bunch of lactic acid and stress on the system that you need to recover from, et cetera, right? Like, do I believe that? I don't know. I still think you're supposed to kind of bust your ass once a week. You know what I'm saying? It makes sense to me.
Gotcha.
Yeah.
Okay.
Makes sense that you should be probably sprinting, doing something
And so
heavy.
how long of a, high intensity workout per week would you say? You said it once.
Yeah, I mean, if we're talking about kind of like an ideal, well, maybe not ideal, but like
starting point,
but like a well laid out program for somebody that this would apply to. Like most people, I think 1 a week
1 hour.
for 20, 30 minutes.
Oh, okay.
Yeah.
All right, that's not bad. So you can probably do a little bit of that.
Mm-hmm.
And that counts. Any kind of activity that just you get your heart rate super high, kind of like 120 to 140 and above, that counts.
Yeah.
Nice.
Yeah, I like
What's
that.
your favorite exercise for that or activity?
Well, I wasn't paid to say this, but I'd say the favorite, like my most recently, my favorite way to do that was go into that this Proof 3, which is a
Shout out
gym
to
in the
Carl.
area. But that's my favorite way to do it.
Okay.
Otherwise, I'm doing something simple like 4x4s, like a Nordic 4x4, where you're basically running at 90% speed for 4 minutes, walking for 4 minutes, kind of getting that.
I'm not familiar with that
getting
one.
full,
So
yeah, and then
running, walking.
Yep, and then you just kind of repeat 4x4s, right?
okay.
And then you basically try to find a speed that's like the top speed that you'd be able to run for 4 minutes, run for 4 minutes.
Oh, I see.
And then, kind of gradually progress through there. And I mean, you get pretty gassed and smoked, and it's got tons of studies behind it to show how it improves VO2 max, et cetera. But like, it's something I can do when I travel. It's something I can do kind of mindlessly, because I know that,
items, you can just go for a run and walk.
I mean, you can change it up, right? Like if you're going to go run a 10K, or you want to go do a Spartan race and you want to like increase performance, you should you get more creative and train a little bit better for that type of stuff.
I remember I was going to turn 40 about 2 years ago, and I had friends who signed up for a Spartan obstacle race, 5K, and I don't do marathons, and I'm not a big runner. Played like soccer just for fun, and I was like, okay, if I can make through this, I'm going to go to 41. Otherwise, I'm going to stay at 40. We're like, yeah, sure. But it was brutal. But it was so fun because you could see everybody else struggling, and there was this kind of bonding experience with people, which kind of takes you back to, like, again, sense of community, achieving a goal with other men or women, and it kind of really gets you excited about, just building something with others, and there's like a common purpose. And that also has been something that's found in different blue zones of the world, where there's like walking, with resistance, being with other people, and just having a community, whether it's eating food or moving together. So really, really, it's still fond memories that I can look back on. So it's definitely fun. What's something that is a common misconception, would you say, in regards to longevity in your experience so far that you work with people, particularly in regards to the exercise component?
It's people who have really good exercise habits, and they're maybe a little bit like on the neurotic side of it, which I don't necessarily think is bad, but it translates into a lot of high intensity activity, like a lot. Like 5-6 days a week of like serious conditioning.
Wow.
For no other reason than to like.
And those are intense. They're not zone 2. They're like 3.
No, their heart rates are in the 170s, 180s for 45 minutes doing their crazy boot camps and things.
Gotcha.
And like I get that. When you get in that world of kind of going that hard, you're just like, your identity's in it, and there's. I get it. Like it feels good, but also, it burns the system down, right? And so people come in and their sex hormones are just in the dumps, man. And they're these great fit kind of looking people. But,
interesting.
just super under recovered and probably undernourished in general. Because to work that much, man, you got to be eating a lot.
Right.
And so that's when you get big nutritional issues in those folks too. Especially with their blood sugar, you start to see some interesting things with that. Like you would see some, it gets really oddly regulated to where they'll have like these rapid, crazy spikes, and then like just spend a bunch of time with low blood sugars.
We're talking monitoring a glucose.
Watching it on a glucose monitor. Anyways, too much stress out there. Like that, people are just going too hard often, and they don't really even understand that concept of like. Of being able to bring down that intensity level to something that we were never taught. Like they never said, when you're training for football or sports or anything like that, like make sure you get a bunch of brisk walking in, like, it's just never been
it's
kind
on
of a
or
thing.
Off for them.
Well, it's lift weights and sprint and do all this other stuff, right?
All intense.
The other times in my life, I'm sitting down on a couch or behind a desk or, and it's just this centerpiece of how the human body is supposed to work that is now missing from our lives, right? And that's kind of what's driving all of this. There should, in a properly functioning human body, it is moving a lot, right? Exercise, we just talk about exercise like it's this extra benefit, or that this movement is an extra benefit. Exercise is medicine. It's like lack of exercise is a risk, Like it almost makes it look like lack of exercise is this neutral ground. It's not, right? And so that's what we kind of have to systematically install back into our lives, right? To really kind of build that aerobic foundation, this foundation for longevity and health.
Really fascinating. I did not realize, obviously, some things that we certainly focus on is trying to get people to tap into things that are free in the integrated medicine world as a practitioner, things that are foundational and things that move the needle, the basics, kind of like I usually go back to is nutrition, hydration, sleep, movement, and stress reduction. Just kind of tap into kind of some of those already when we just discussion, but we certainly look and make sure there are, particular markers which we'll briefly get into are, optimized, or sugar levels or insulin levels or, hemoglobin A1C. But fascinating that if you are, these people are really working out hard, they're actually, not recovering, obviously, which, stress on the body in many different ways can present itself, but then also recovery through sleep or adequate amount of rest, hydration and other things. But fascinating that actually their hormones crash.
Oh yeah.
And their metabolic health goes down.
Well, yeah,
Even
sometimes not
fit.
as, well, I mean, it does. It goes, sometimes it looks good. Like, I don't think they have problems necessarily with high sugars on the whole, but like it gets dysregulated from a lot of that overstress.
But like testosterone, you
and
see
the
that
dumps
actually go down, and if they're over-exercising. Interesting.
Like in a large way, like in a huge amount. Yeah.
And the solution is just simply to create more space for you to recover and just stop.
Yeah, exactly right.
Doing
You reel them back. There's a large portion of people that if reeled in a bit, things would just get a lot better.
Yeah.
It's one of the most common things. It's just like, dude, I slowed down a little bit, and I feel so good. Like I'm like this energy. Like I was always tired from all that, going so damn hard.
Right.
And yeah.
That's fascinating.
Yeah.
Awesome. So, and feel free, if there's a particular topic comes to your mind that you want to discuss, happy to bring it up. But I know you do different testings at your clinic. Maybe you want to kind of share a little bit about some of the things that are near and dear to you in regards to assessing someone's holistic fitness, holistic ability to kind of say, I'm on the right path to live long and have a quality life. Before we get into maybe some markers that you
for sure
like.
Yeah, no, I mean, we could touch on them as we go.
And obviously I went through that with you guys, and so that was really fun.
You went through the program with us, and I mean, we can use you as a like an example person, kind of walking through. But look, I think knowing what condition the body composition is, and where we're starting from, it just tells a whole bunch about kind of what's going on. You can look at muscle mass and fat and visceral fat and bone density, and when people make meaningful changes in their lifestyle, you see some like pretty radical changes in those. That show you the story behind it all, right? Especially as people's body composition changes and their weight often stays the same, and they come in frustrated because all they saw, I've been doing this for 4 months. I trusted you.
The scale is the same.
I weigh 3 more pounds, and you're like, oh, dang it, But then you get this DEXA scan, and you look at the difference, and there's like 8 pounds of fat gone, and like 10 pounds of muscle, and then you're like, well, look what happened underneath the hood, right? And then they're like, my clothes do feel better. Much better thing. Right. So that's an important one. So we do the DEXA scan. Got to know where you stand on that. I mean, it just gives you a lot of good clues on where to go. Metabolic testing, so the resting metabolic testing, seeing how well you're burning fat at rest. I think that's a pretty important thing to do. If we can train our bodies to leverage fat for all of our baseline energy while we're just kind of existing throughout the day, I mean, it's working dividends. Like while we don't have to do anything.
Yeah, that was a big one for me because your clinic basically showcased that I am burning a lot of carb and not fat, and so that was an interesting input that I had never tested before. So that was helpful.
I'd love to know even more in depth of how your body uses fat, like during our exercise metabolic testing, right? Sure, we get the VO2 max, which is a cool number, and we can brag about it and whatever. But understanding what what's your max amount of fat that you can burn during exercise, right? The maximum amount of fat oxidation. You see some drastic differences between numbers in people. Like there are these like elite endurance athletes. These folks are able to roast like 15 calories of fat, per minute, and like they've just got this
access to an infinite large amount of fuel in their body when they're exercising. And then, a lot of us are at like 2, per minute. And
is that genetics? What is that mostly? Is that adaptation through life?
I think there may be some. There's definitely got to be some genetic component to it, but a large that large swath of how good you can be, most individuals can achieve some pretty good improvements in there. Yeah, there's a lot of room for improvement in most folks where they can probably be doing something nearly as good.
And that will be through.
That's through spending more time oxidizing fat, like spending more time in those low movement but frequent zones of activity where we're leveraging that, or we're really using that. Or if we want to be more intentional, where's that zone 2? When we're doing the exercise test, I can see kind of where that fat peaks, and it's usually near people's zone 2, right? And so you've got this heart rate range for people where you go spend 4 hours in that, like however you want to do it, and then like call me.
Check back.
Yeah. Awesome. So, and then they check back in, and then they go, oh yeah, this is great.
Gotcha.
And
then you guys do movements.
Yep, we do a movement screen,
really
like a strength screen. That's, which again, super important because when you start thinking about, because I know I've been talking a lot about the zone 1 and zone 2 stuff, but like that's just to impress upon the fact that it needs to be the bedrock of everything, and then we build this strength training on top of that, and what you need to know what you're working with, where your limitations are, where you're going to injure yourself. How do you prevent that?
Yeah, as a society, we're moving less and we're sitting more and we're on the screens and the digitals, everything. And so I think it's huge. And our ancestors were not doing that. They were just constantly moving. So that's definitely an important component. Let's talk about a little bit on parameters and metrics. And in integrative medicine, functional medicine, we do a lot of that. And obviously, you guys tap into a lot of specific markers that I was really excited to look at when you ran my tests. And one important one that particularly I look at for overall wellness is your inflammation marker, the HSCRP, high sensitivity C-reactive protein. And so we like to keep that less than 1. What are some particular markers that are important to you? If someone's coming to you, like give me the top 3 markers, top 5 markers that really helps me kind of hone down on I'm on the right path, or I need to optimize. And if you want to share specifics for it to actually be more applicable for our audience, feel free to share that.
Sure.
I know there's a lot out there, but
no, there's a lot. So let's put it in. We'll make it kind of by sections. But how about this? We'll go muscle mass, from a DEXA scan, and I'll take the visceral fat from a DEXA scan.
Okay.
I'll take a fasting insulin from the blood tests. It's a ApoB from the blood tests.
Okay.
And
for your cholesterol.
Yeah, for the cholesterol.
Subtype of cholesterol.
Yeah, for the cholesterol. Because we're going to be able to plan off this. I've got his, yeah. How about
help me live long forever?
Yeah, and then that's VO2 max.
Okay.
All right. No, that's all right. It's a pretty sweet list. I mean, this is kind of a tough problem in general, but I'm going. If you give me those, I can probably write you probably a pretty reasonable plan from there.
And those are things that you would like people to optimize for solving for high quality, long life, basically.
Yeah, I think more as a report card of what's the current state of things.
Got it.
And then we're going to use those to really kind of address what we're going to do about it. And so I think with the muscle mass, right? We know, hey, how big of strength training, is that of a priority of ours in this situation? The visceral fat really just to kind of help me with some risk. and a little bit more into the metabolic health to understand where we're at with this person. How metabolically unhealthy are they? There's this whole kind of spectrum of it, you know, and it's good to know when you can improve there, which is why I also get the fasting insulin,
Right.
because most people will have an okay, like a A1C that's not pre-diabetic. You know, maybe their CGM's a little bit wobbly. You don't like to. You can send them for this, you know, 2-hour oral glucose tolerance test, or you can kind of assume what it's going to be from looking at a fasting insulin, right? And saying, hey, like, you know, there's some likelihood of some insulin resistance here. Super important, and like what these big priorities are, and like, don't pass go until you get this stuff sorted out, right? Like this is priority one. And then the ApoB, again, I think just to help with some of the heart risk, you know, I guess I prefer, we always go after the metabolic health first, but you know, we'll be able to tell a little bit about his risk from that. And then his VO2 max, right? Like, does he have a high level of functioning? Is this somebody who, you know, is almost like at a super low level where this is such a huge priority for them? So
when I'm looking at those as systems based on what you are kind of looking as your priority to kind of keep someone well long term, sounds like there's definitely kind of your metabolic health in there, cardiovascular health, a couple of different ones with cholesterol and so forth, and then muscle mass, and you know, just like and muscle obviously, you know, being a higher metabolism organ as a whole compared to other systems, particularly compared to fat. So
how about this? But also like muscle, but I'm like, in my brain, I'm using it as a surrogate for strength.
Sure.
You know, and that's the more important. Like I definitely want that. I'm fine with people with like super average amounts of muscle mass that have good strength.
Okay. So not necessarily muscle does not necessarily equal strength. So
of course.
In your
you know,
book,
I mean,
some people who have what they look to be actually pretty. So would you see people who have high amounts of muscle, but then their strength is not consistent, or you are surprised with their number of?
I suppose that that, or you know, super big muscles and, you know, maybe not as strong. I mean, still going to be strong because they spend a lot of time working on that stuff.
Some questions on here that pop up. We'll go kind of rapid fire on some of these. So I think you've done this before on some of your videos as far as questions, rapid fire. But this is more just kind of general questions. But if someone was to say pick one, longevity, nutrition, or exercise, which one would you give the side of the scale?
All right. I'm going exercise. I think the more you move, the less the quality of calories matter. Not that they don't, but when there's a bunch of turnover, a lot of activity, a lot of calories burned and a lot of calories needed, and that high turnover rate, that is so much more forgiving than, if you're not doing that. So. Gotcha. I'm going to exercise. Yep.
Okay, I think I agree. Let's see. We already touched base on some of these, actually. Interesting. What about longevity? What would you say if an athlete wants to stay performance peak state, but they're aging? Does fasting or intermittent fasting or restricted, calorie restriction, does that hurt them? Or is that, so someone who was an athlete wants to stay performance ready
fit,
and stay, fit. There's a lot of data on fasting, intermittent fasting, and so forth. But there's also a lot of controversy on, well, this person will not have the performance ready. So thoughts on that? Are those two on different sides?
I see. I've got thoughts. I mean, have you ever done intermittent fasting?
I have.
Yeah. And I mean, going from not intermittent fasting to intermittent fasting, just some benefits.
I mean, definitely, but it takes a while for me. Yeah. But in regards to like long term, would be the
energy.
More question.
No, I guess to then go there's I did, and then there was kind of a peak of its efforts, right? Like, okay, you're like, oh, I'm noticing some improvement. I'm a little bit of weight loss here, I got some energy in the morning. everything's going fine, and then it kind of stops, right? And then it kind of just becomes the new norm. You know, now you're just a guy who does. I don't like actively practice intermittent fasting. I'm just somebody who doesn't eat till 12 or 1 p.m. You know, because I don't get hungry. Okay. I stopped doing that a long time ago when I was doing this thing called intermittent fasting.
Okay.
Do you see a lot of people like this is a pretty common like archetype out in the world right now? I think I would probably have fallen into that category at one point too.
So you're saying you do or do not do it now?
I don't think. I think it's too hard, man. Because I think when you're more intentional about what you eat, and it's specifically if you're trying to achieve a protein goal,
sure,
it is so hard to do in 8 hours.
Right.
You know,
right.
That's really hard.
Yeah.
And so you just got to be a little bit more forgiving with that window, and then it's a logistical thing. You have to plan it into your day to get that done.
Right.
Right. And it's easy to say it, but then actually putting the food in front of you at those times, you know. And so I know it's not a free resource. I mean, people can meal prep themselves, right? And so like if you can't afford it, then like better be meal prepping then.
Yeah.
That's how you do it. But there's some good services out there too that help people who have a little bit more expendable income.
Sure.
Or you know, and if you're trading it for your groceries, it's not really that different. Some of these places are pretty reasonable, and you account for having that food there. It's the consistency.
But you're hesitant in regards to intermittent fasting for someone who's an athlete who wants to stay performance ready. Would you say? Am I taking that accordingly?
No. Yeah. Don't do that.
Not long term. Yeah. Okay. Any questions for me?
Yeah, I got a question. You know?
And cut.
No, I guess like as far as exercise theories or principles, I mean, is that like how do you think about that stuff, like for patients or for yourself?
Yeah, I mean that's your world. I would say that's really this is.
But I mean, you do primary
share
care.
My thoughts. Absolutely,
and I like to
appreciate it. But definitely, for me, I like to see people. I like to meet people where they're at. So if someone's coming to me and they don't even move, I'm like, okay, well, let's take the next step. Let's go for a walk. And I've had people who are extremely anxious. You know, they can't even spend time with people. They can't even get out. They're always in their house. I'm like, well, let's go for a 5-minute walk. Can you do that? So kind of stacking in very small amounts of activities because, you know, as we talked about, you know, it really helps you in emotional space. You know, I would say the fastest, cheapest, best way to get out of your state is just simply take another step. And so for me, I kind of find where they're at. If they're an everyday 1-hour workout, that's a very different recommendation, obviously, you know, versus someone who's not even moving. But I would say definitely my priority thing is for them to actually start walking every day, some sort of walk. After dinner, particularly, would be a great one, or when they wake up in the morning. And as we sat down and talked, that, you know, that's something that I've incorporated in my mornings. Yeah, I get my little espresso, and then
that's right.
I try.
What do you think? Have you been? What have you been thinking about that? Like, add that into your life?
Yeah, it's been great. So I have enjoyed it because it kind of really gets you going before you actually, you know, get your day started, and you get better blood flow. I think you kind of almost have better, you know, presence, energetically more alive and active too. Yeah. So I like that. And again, it's short, it's quick. And so now honestly, I have the same routine, the path that I go, and then I come up here and do some stairs. So I would say walking is the main thing that I usually recommend people to start, but then definitely having some sort of high intensity. So HIIT is my favorite thing when I recommend to people. I usually have people do component of, you know, items that are recovery induced, you know, like red light or infrared sauna or a cold plunge. But I always try to have them separate something like a cold plunge from their exercises to kind of not dampen their, you know, muscle gain. Yep. So, but it's very difficult, you know, depending on who I'm making that recommendation for.
Yeah, for sure. On the recovery stuff, I mean, is that more, I don't know, like best practices and probably good stuff, or is there anything that you kind of track or really notice improves from things like red light and some of those therapies?
You mean markers?
Yeah, I mean, if you use any or not, but or like how do you
Oh.
mainly kind of implement that?
Yeah, I've not looked into to see if they've done. I mean, you feel free to share if you have in regards to like certain recovery stuff with like markers that you check. But for me, it's like symptoms.
Yeah, I guess I
symptoms.
meant like maybe you watch somebody's CRP go lower using
Oh,
sauna
gotcha.
or something like that. You know.
Yeah, I've not actually looked into that to compare. I mean, we usually utilize, people's symptoms and say, okay, this is elevated. You've got that injury, so let's recheck this and do these things that are recovery supportive, whether it's laser therapy, red light, infrared sauna, cryo, whatever it is, and then we can recheck in 3 months. And so I've done that. Sometimes it does reflect it, but then, they could have poor sleep or panic attack or urinary tract infection. And you're like, it's not very consistent. So I would love to have a particular marker that can be used. But I usually go off of symptoms. And yeah.
All right. Well, cool.
Awesome.
And then, so how long have you been doing it now with more of the
For the morning?
walk-in? Yeah, the morning stuff.
I want to say at least 2 or 3 months.
2 or 3 months.
Yeah.
All
I've been doing one workout, like high intensity workout, try to catch the peak workouts at Proof. So that's been nice.
Cool.
So.
All right. Well, we got to get you on the DEXA scan again in 6-8 weeks.
Okay. Deal.
All right.
Awesome.
We'll see what the score says. Yeah.
Yeah. I will be looking forward to that. Well, thanks for taking the time.
Yeah, of course, man.
You
Thanks for having
look here. Let everybody know where they should follow you or find you in regards to if they want to come out and get some testing done. Or
Yeah, for sure. If any of this resonated with anybody, it's a pretty cool program. People come in, they
I
get
can definitely attest to that.
Yeah, they get our physical. We do a lot of blood. We do blood work on them. We do a bunch of testing that shows us some really important metrics, and we put all that stuff together in a report and sit down with people, give them the state of their body, and build a plan with them on how this looks moving from here. What it looks like in the future, but what are these next steps and how do we get there? And that's open for everybody. And then some people actually come on as clients and work with us long term, where we drive a lot of improvement, a lot of risk mitigation, implement these best practices, and kind of watch these metrics improve, and like just really take stock in their health. And we help them do it and show them how it improves, right? And kind of light the path a little bit so people can get more health agency.
Nice. And that's Preamble. And you're on.
Yeah, we're on Instagram and just Google.
Website.
Yeah, Preamble Scottsdale, and I think it's preamblehealth.com.
Awesome.